أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم
Assalamu alaikum wa rahmatullahi wa barakatuhu. The current pandemic infection with coronavirus, COVID-19, has spread right across the world. This is affecting all the communities, but especially one of the problems we're having is with our mosques. What do we do with mosques with government guidance coming out, which is changing on a daily basis? A couple of the points I will address here are personal views as a GP who's been working in the health service for the past 20 years and is currently leading on matters around COVID-19, coronavirus, within general practice. So the first question is, should the Madrasa, the Masjid, stay open? Well, as of today, the 16th of March 2020, the government briefing, the government measures that have been taken did clearly say that this is not yet the time to close schools. Now, what I do feel is that the schools and mosques should be aligned, and when the schools are closed, without discussion, the mosque should also close, and that includes mosques and the masjid. The difference being, one is the prayer facility for the Jamaat prayers, and the other one is the school for the children. Now, it is useful at this moment in time, rather than closing the mosques and sending the children home, to use this opportunity while we are not in the peak of the infection yet, to teach the children how to wash their hands effectively, but also what does social isolation mean? What can children do when they're at home? As of today, the measures have suggested that the period for staying at home, social isolation, has moved from 7 days to 14 days. Now, if you live alone and you develop the symptoms of coronavirus, which is a new continuous cough or a temperature above 37.8 degrees, then you should still only take 7 days off. This is if you live alone in a house. If you live with other people in the house, then the whole household needs to take 14 days off. What this means is that for an adult living in a household who develops either one of the symptoms or both of coronavirus, which is the cough or the temperature, then the children in that household who come to the mosque also need to be excluded from mosque for a period of 14 days. Moving on to the issue of the local community coming to the mosque, there is no hard and fast rules, but what I have recommended to local mosques in Bolton is that the mosque committee should suggest to the local community over the age of 70 that they should pray at home, in view of the fact that they are most vulnerable to picking up the infection and potentially will end up suffering the highest consequences should they catch an infection. Between the age of 60 and 70, if they have any long-term conditions such as heart problems, diabetes, chest problems like asthma and COPD, or even if they have cancer, they shouldn't come to the mosque and they should pray at home. Those between the ages of 60 and 70 who are fit and well would be able to come to the mosque, but take extra precautions, making sure that they wash their hands regularly, and should they develop any signs of a cough or temperature, they must exclude themselves from the congregation and pray at home for a period of 7 to 14 days, depending on whether they live alone or with other people in the house. Anyone under the age of 60 should manage their own health if they have a long-term condition, and for example, if they have asthma and they develop shortness of breath or wheezing, they should manage their condition and not go to the mosque until their condition has fully settled down. With regard to the imams, the teachers in the mosque, we need to use similar position that those imams that are over the age of 70 for their own health benefit should be asked to stay at home and not come to the mosque. And likewise, for those that are between the ages of 60 and 70, if they have long-term conditions, should be outside the mosque at home. Those that are between the ages of 60 and 70 in good health should be allowed to carry on teaching in the mosque, and those under the age of 60 should manage their health if they do have an exacerbation. Clearly, these are individual decisions that the mosque committees need to make, but I'm providing you some insight based on national guidance and from a doctor's perspective. The other common question is whether the wudu khana, the area where you wash before prayers, should be left open. Now, my advice has been to close the wudu khana because the infection, the COVID-19 infection, is transmitted through droplets when people cough. Now, that could contaminate water that's splashed around the wudu area, and that could then be transmitted from one individual to another, as the virus can survive for hours on hard surfaces. The advice to give to the people coming to the mosque for prayers should be to do wudu at home, at the office, at a place of work, to ensure that when they come to work and when they come to the mosque, they don't need to perform wudu at the mosque. Another issue to consider is what do we do about the prayers in the mosque. We'll split this up into two sections. We'll do the Jamaat prayers, which is 5 times a day, and the Jummah prayers on Friday. Now, as far as the Jamaat prayers are concerned, we need to ensure that the prayers are as short as possible, and if we can, just to pray the mandatory, the Fard prayer in the mosque, and ask the congregation whether they would be willing to pray the Sunnah and Nafil at home. The national guidance around congregations and staying together is that we need to try and maintain a 2-meter distance between each other and not have more than 15 minutes contact. Well, as you will be aware, with regard to congregation prayers, you are shoulder to shoulder, and therefore distance isn't an option. But as far as the 15 minutes are concerned, if we pray just the Fard prayer and speaking to the imams ensure that the surahs prayed within the salah are short, then we can ensure that we are together in a congregation for the minimum time available. Once the prayers are finished, it's best to disperse out of the mosque and not end up congregating to have discussions. The other thing is the Jummah prayers on Friday, when there are usually big congregations. Now, once again, if we can ensure that the khutbah is kept very short and the Jamaat itself during the Jummah prayers is kept short with short surah. Now, if there is a large congregation, then it's for the mosque committee to consider whether they can have more than one Jamaat during Friday afternoon to try and keep the numbers low. But what we need to ensure is that whilst the first Jamaat is proceeding, you don't end up with a queue of people outside. Otherwise that defeats the object, because now you would have a congregation of close standing people who could potentially pass the virus to each other. So what we need to ensure is that the movement of the people through the mosque is quite fluid, retaining the minimum time necessary to do the prayers before they disperse. Now, in terms of the Madrasa, the school element, we need to ensure that all school children are aware of the symptoms of coronavirus, which is a new continuous cough or a temperature of 37.8 degrees or more. As far as the children are concerned, if they develop a new cough or they're feeling hot all the time, we should be aware of whether this could be COVID-19 infection. If you have a child with a cough or a temperature, they should be sent home and should stay at home for a period of 14 days. After 14 days, if their symptoms have improved, they're allowed to come back into the mosque. There is a problem where you have mosques with Hifz class where there are students memorizing the Quran, And for those children to go home for a period of a couple of weeks may end up causing disruption to their routine of memorizing the Quran. This is even more of a problem where the Imam may be elderly, sometimes over the age of 70, and if they are excluded from mosque and teaching, how do we ensure that his students carry on progressing? Now, the options could be to replace the teacher with another suitably qualified teacher, or in today's world we can use various technologies such as video conference calls where the teacher can still be at home and use Skype or any other platform to communicate with the students in the mosque. But we need to consider these challenges because it's very likely that soon the schools will be closed, and when the schools are closed, the mosques will be closed. And how do we ensure that the students, when they're at home, still have that communication and education with their teacher? During this period with coronavirus, we need to ensure that there are no lectures or gatherings in the mosque beyond those that are absolutely necessary, which are likely to be the Jamaat prayers. Another thing that mosques need to consider is cancellation of any gatherings or weddings that may be booked for spring and possibly into summer. Today's measures identified by the government were very clear that the coronavirus may last weeks to months, but it may even progress even further. The likelihood, as things are progressing at the moment, is that over the next 3 to 4 months, we are going to be struggling with the consequences of this infection, and it's very likely that many mosques will have to remain shut for that period of time, resulting in cancellations of any jalsas or weddings that are being booked. So give the people who have booked the venue advance notice from now that the likelihood is that they will be cancelled, and should they be able to make alternative arrangements, that's at their discretion, but at least the mosque is not then obliged to provide this information at the last minute. The last thing to mention here is about providing information to the children in the class about what to do should they be asked to go home and self-isolate for a period of 2 weeks. Now, this is not an opportunity for the children to go home and play in the streets or play in the garden or the park. This is an opportunity for them to go home to ensure that if they are carrying the infection, they are not transmitting it to other children. And that can happen outside the mosque as well as inside the mosque. The children should be ideally restricted to one room in the house, although they will move around depending on their age, and food should be taken to them rather than eaten in a communal area within the house. They can play in the backyard or garden, but you should minimise the risk of transmitting the infection to other children by not inviting their friends, family, or other relatives to the house. After a 2-week period, they should be fine to congregate with family members and play with friends. If possible in the house, try and keep the windows open to allow fresh air to circulate within the house. And as always, if they have an infection, a cough, then teach them how to use a tissue, which is catch it, kill it, bin it. Sneeze or cough into a tissue, put the tissue into a bin, and get rid of the bin when it's full. Now, at the moment, the advice I've been giving, which is in line with advice from infectious diseases, is to use a plastic black bin bag and put the tissues in the bin bag. And at the end of the day, tie the bag off and put it in a second bin bag and tie that off as well. Put the bags in the corner of a room somewhere, and after 3 days, that rubbish can be put in with your normal bin outside. So that is tissues into a bag, tie the bag, put that bag into a second bag, tie that bag also, and after 3 days that can be put in to the outside bins. There's a lot of discussion at the moment around whether masks are effective with regard to the coronavirus. I've seen people walking around with masks like these, the surgical masks, and I've also seen people wearing these, which are the kind of masks that builders wear. Neither of those masks are effective. They don't have a good seal, And if anything, all you will end up doing is touching your face more often, which will end up putting you at higher risk of getting an infection. Second and most effective thing you can do to combat the coronavirus is to wash your hands with soap and water. The surface of the virus is a fatty surface, and soap and water manages to break down the virus and kill it. As well as soap and water, if you are out and about, it's useful to carry one of these little bottles, which will help clean your hands if you feel that you've been in contact with an area that may be infected. I'm going to show you how to clean your hands. It's the same technique with this gel as it is with soap and water. This is the technique to clean your hands with soap or water or with gel. Showing you with the gel, take a bit of gel in your hand. Step 1, rub the palms together. Step 2, fingers on both sides, back of the hands. Step 3, interlock the fingers, rubbing the hands together. Step 4, make sure your nails are clean. Step 5, do the thumbs on both sides. And finally, to finish off, clean the palms of your hands on both sides. This is going to be a very difficult time. Children are going to get frustrated. They don't like to be isolated for a period of 14 days. They'll miss their friends at mosque and at school. But we need to ensure that this infection is broken by not transmitting it from one person to another. During this period, if you are isolated in the house, do not go to your GP, do not go to the hospital, and do not go to any pharmacy or dentist in the community. If you have internet access, go online 111 where you can get advice, or if you don't have internet, ring 111 where a healthcare advisor will provide you guidance on what you can do. If after a period of 7 to 14 days you feel your symptoms are still not improving, you should ring 111 to get further advice. Inshallah, we will all get through this, but we do need to take these precautions to ensure that our community comes through healthy at the other end. Jazakallah. Assalamu alaikum wa rahmatullahi wa barakatuhu.